We lead with us at this hour, the Gauteng MEC for Health and Wellness, Nomantu Nkomo-Ralehoko, will on this day join postpartum mothers in welcoming their newly born bundles of joys at Leratong Hospital in the West Rand district. During the ceremony, mothers will be presented with babies' gift hampers. Additionally, the MEC will also use the opportunity to engage parents about the importance of registering their babies immediately after birth at the Department of Home Affairs. Furthermore, the MEC will also emphasize the significance of timely immunizations and breastfeeding to promote babies' development and protect them from preventable diseases. Reporter Mbalenhle Mthethwa is in the West Rand. We join her live. Now, Mbalenhle, of course, a lot of smiling and happy faces from exhausted mothers who would have given birth early in the morning or overnight, and the MEC is there to welcome a lot of these babies. What are the sentiments in those postpartum wards at this moment?
Well, certainly it's a moment of joy and happiness for the mothers who are here, as well as the MEC who joins us right now as she's been doing the rounds. We've been following her as she has been doing the rounds, speaking to some of the mothers who are here. Thank you so much, MEC, for taking the time to speak to us. You know, this is a milestone for many people, you know, and the experience that they experience at hospitals is very important. Talk to us about what you have done to address some of the complaints by first-time mothers or mothers in general who talk about, you know, being treated unfairly by, say, the nurses.
No, what we have done, we have a campaign that we have launched at the Department of Health called I Serve with a Smile and Care campaign. That campaign is bring back the element of dignity and ubuntu that we must always show when we're treating another person, because it doesn't need you to go to school to know that when a person is next to you, you must treat that person with the relevant care and compassion that they deserve. And it's part of us now that in our culture, even in the training where we're using part of the chapter of I Serve with a Smile campaign, because it comes back from Batupili. So that Batupili principle that we have as government, it's helping us now to implement it through I Serve with a Smile campaign. Hence, there's this sudden change that is happening in our institutions. But again, anyone that is being ill-treated by a sister or a nurse or a doctor or a cleaner in the hospital, because it's not only them that does that, or the administrator at the reception desk, we attend to those cases and make sure that we have quality managers in all the hospitals, and a box that we have, I call it a complaints box. But the other issue that I've done now, which I've launched it last month, it's MEC's desk in every hospital. It's MEC working with the quality managers of the hospitals, taking daily all the problems and the concerns that we are receiving. And I think it's working, because now they know when we have done somebody wrong, I will definitely intervene through the MEC's desk that I've launched it in every hospital.
We have one of the mothers who's given birth. Your child, your daughter, is a premature baby, and you gave birth at 1 a.m. Just after the clock struck 12 and everyone had ushered in the new year. How are you feeling? What was your experience, and how were you treated by the nurses as a young mother?
I'm feeling happy. I'm blessed. As 2026 just began, I got a blessing from God, and I appreciate that. The nurses treated me well. They didn't do. They were just nice to me, and I really appreciate how they treated me.
And especially since you gave birth to a premature baby, and this is why your baby is not here with us. How are you feeling about, you know, the care that your child is receiving right now? Do you believe that, you know, it's of good standard, and that you are going to be able to walk out of here with your child in hand?
Yes, I do believe that, because I trust the doctors. I know that they will make a plan that each and everything that is happening to her, she will be good.
Okay. And how do you feel about the gifts that have now been handed over to you right now?
I'm so happy. I really appreciate it. It means a lot to me.
MEC, it seems as though the lady has expressed trust and confidence in the healthcare system here at Leratong. Would you say that patients can expect the same in all the other hospitals in Gauteng?
Definitely, there's most of them now. When you go to every hospital, you don't get. In fact, I always say I get more compliments than complaints now in our hospitals, and I'm really happy about the effort that we're trying to do as nurses and doctors, all the clinicians, including the physio, the administrators, the security from the gate, because everybody must be treated fairly and equally so. And I'm really happy about the trust that now South Africans have, especially the Gautengers have in our healthcare system, because the lady that is right at the corner there, she had the choice of going to a private hospital because she's a teacher by profession, but she decided to come and deliver here at Leratong. And I'm really happy about that people who've got medical aid, they come and deliver in our hospitals. But again, we're introducing now an app that you can pay in our hospitals with your medical aid, but you can only do that when you have trust that I will go there, I will deliver my child, and I will be treated good, not bad like it used to be before. So we're building up on the trust. It's very difficult, trust me, but we'll definitely show that we improve.
Okay, there you have it. The MEC interacting with some of the patients here at Leratong Hospital, where 5 New Year's babies have been delivered so far. There are more of them coming through, and as you can see, there are gifts that have been handed over.